Well, one of the selling points of President Obama's health care reform legislation, now the law of the land, was his promise that people happy with their health insurance programs could keep them. But correspondent Molly Henneberg reports that may not be an option for many consumers.
121 pages of new rules were announced this week outlining which health insurance plans will be grandfathered into the health care overhaul and which ones will be subject to the new laws and mandates. Bottom line, a plan has to stay pretty much as is to avoid government intervention.
If health plans significantly raise co-payments or deductibles or significantly reduce benefits, for example, just stop covering treatments like HIV/AIDS or cystic fibrosis, they lose their grandfather status.
Except for one group, labor unions. The new rules say, quote, any health insurance coverage provided pursuant to the collective bargaining agreements is a grandfathered health plan, even if there's a change in issuers, meaning insurance providers. Republican Senator Chuck Grassley says non-union businesses should have that flexibility too.
If it's good for a union contract health care plan, it ought to be good for a corporation health care plan.
President Obama has promised repeatedly that his administration would not force people off of plans they want.
If you like your current insurance, you will keep your current insurance. No government takeover. Nobody's changing what you've got if you're happy with it.
But some business advocates say small companies now won't be able to shop for a better health care deal without triggering the new government regulations.
And they'll have to go out and either start searching for more expensive plans or consider the possibility of getting rid of coverage altogether.
And potentially face a fine for not providing that coverage. But others say the administration's new rules seem fair.
They enable a small business who really likes the plan they have to keep offering the plan within certain guidelines.
Still, the Obama administration's own estimates say that up to 80% of small businesses and 64% of large businesses may have to give up the plans they have today within 3 years. In Washington, Molly Henneberg, Fox News.